Okay, good morning, Carol Johnson.
And good morning to you, Bob Bonte. How are you?
I'm good. So it is Wednesday morning time for our weekly COVID-19 update here at Harlem Emergency Network. And I guess the top story of the day is that New York City is doing shutdowns again. We thought we were past that, but we're not.
Well, apparently people are in a hurry to get back to normal, which, we already assessed probably will never take place. But they're doing everything to prevent the new normal from even taking place, you know. So the rioting and the protesting and the burning of rubbish and all the different things that's happening in Brooklyn, couldn't have happened here.
hmm that's absolutely true. So just to bring everyone up to speed, if you haven't been following this, there have been increases in the incidence of COVID sharply in areas of Brooklyn and in some areas of Queens as well. And it's been particularly focused in the areas where there have been large populations of Orthodox Jews, that they've had sharp increases in cases. Now, coincidentally, these sharp increases come because these populations have openly flaunted the rules in terms of gatherings. And so this has been brewing, but the interesting thing about this brewing is that once again, Mayor de Blasio and Governor Cuomo are not on the same page. So while Mayor de Blasio started to bring in plans on how to deal with this, Governor Cuomo came in and he brought in some other plans. We're going to bring in our partner Wali Abdul Noor to also talk about this. So what happened, and I want to say good morning to Lynn Miller, who's listening on Facebook. What happened is that Mayor de Blasio's plan to deal with this, evidently he was basically trying to do a plan that was based on zip codes, but did not focus on the source of the threat, which basically is the behavior in the Orthodox Jewish community. And Governor Cuomo did not agree with this, and Governor Cuomo's authority, as we've seen throughout this pandemic, Trump's, pardon the pun, Trump's de Blasio's. And so Governor Cuomo came out with his protocols, which were more based on proximity to the infections and not zip codes, and it also specifically called out houses of worship. And so I think this is an example where we see where our public health policy sometimes gets impacted by local politics, because it's clear that that community has had more sway in terms of being able to flaunt the regulations and not have any adverse effects from policing. I'm going to show in particular a video that we found online that shows some of the behavior that's been going on out there. So it looks like it can't. Let's see if I can get it to play. No, looks that's not going to be available. But there is a video online where we've seen a large gathering of Orthodox Jews dancing in the streets, no masks, no social distancing, large crowd. And we look at this video and know that if this were a group of Black or Latin teenagers out in the middle of the night dancing, there would be a strong police presence. I'm sure there would be arrests. There would probably be some injuries. And the fact that that crowd in Brooklyn was able to do this with no and the police were there, but they just kind of herded them in. They weren't able to force them to stop. And this is the type of behavior that has caused the increases in these neighborhoods.
Well, actually, Bob, we saw it happen early on.
Mm-hmm.
Recall the time when they showed the contrast to the African American people walking on the street, minding their business, standing on the street corner,
Mm-hmm.
and they were pounced on and
Mm-hmm.
arrested. And even the judge said, I'm not going to prosecute these cases
Mm-hmm.
because it was racially biased.
Mm-hmm.
And 100 people were like locked up in like 2 days
Mm-hmm.
that were all people of color. Now, these
Mm-hmm.
people were not only protesting, but I mean, they were pushing back on the police officers, setting things on fire, the rubbish on fire, but literally pushing, the police officers out the way. And we've seen this in the contrast where even in Central Park, people, uh, Caucasian people were being offered masks and they wouldn't take them, and the cops wished them a good day. And while we were getting arrested, now they're doing this in Brooklyn and, chanting Jewish lives matter. When the thing is, most our houses of worship and other houses of worship are still closed. And when they do open, they have to maintain not even, I think it's a 25% capacity.
Mm-hmm.
So, just the fact that this is going on and there's no real repercussions behind it, it's a clear example that, the more things change, the more they stay the same.
Absolutely. So apparently, this is a 14-day restriction. What they've done is that they've gone in these areas and they've divided them. They've come up with a color coding, red, orange, and yellow. And with the red, only essential businesses can remain open. I think with orange and yellow, there are different variations of slightly less restrictions. And it not only affects these designated areas in Brooklyn and Queens, but there's also an area in Rockland County and Orange County that they're also putting these restrictions on. So while none of this is affecting Manhattan or Harlem or the Bronx, it's just an illustration that we have to be prepared. We've been saying this for several weeks, to prepare yourself for a second surge, and we're seeing the early results of this. Week to week, we're seeing more and more of an uptick in selected areas, and so we're obviously urging people to not wait for it to come to your area. It may not come to our area, but it may come to our area because this is a city. There are no boundaries. There's nothing restricting the people from getting in a car in Brooklyn and riding to Harlem or the Bronx or Queens or even Staten Island. So we again remind people it's time to raise your game back up again and not play around with this virus, because it's not playing with us.
Yeah, I think that that is very much right. And when it started the first time, people weren't trying to get it. It just came on them. And now
Mm-hmm.
people are trying to get it. It's liable to be a big difference.
Mm-hmm. Yeah, absolutely. The other minor story this past week, our president got COVID-19. So you've already all heard this. We're not going to belabor you with the things but what we want to do is talk about that particular situation in regards to what other people are not talking about, what can we learn about his COVID situation that applies to us? And so there are a couple of things we want to point out about that situation. Number one, let's talk about what were the what was being offered to him that may or may not be offered to us. So he was given two experimental drugs that I guess are being, as we know, the pharmaceuticals are pushing through antiviral solutions. Some of them have had more effects than others. There's one called remdesivir that's produced by a pharmaceutical called Gilead Sciences, and I think I've been told that he has some sort of interest in that company. I can't confirm that right now, but I do believe I read that. And there is another one called dexamethasone. And again, these are pharmaceutical drugs that are in the experimental stage. But what I wanted to talk about were the things that he's also been taking that are not experimental. So lo and behold, his physician, the White House physician, Dr. Sean Conley, in addition to reporting them taking these drugs, he's also been taking zinc, vitamin D, famotidine, melatonin, and aspirin. And we obviously want to talk about the zinc and vitamin D because we have been telling people since early March, maybe even February, about zinc and vitamin D. And we have been surprised and disappointed that the press doesn't pick up on this. We probably mention it just about every broadcast that we do because we keep getting validated. And so if these experimental drugs are so good, why are they still giving him the zinc and vitamin D? And the reason it is because it's been known to have positive effects on people with COVID-19. And so we're saying it again. We've said it a million times. We're going to say it a couple of times more. Make sure you get these nutrients in your system and tune your immune system. Don't wait till a super spreader like the president comes to your house. Hopefully that doesn't happen. But if he does come to your house and he infects you want to have the vitamin D and the zinc already in your system, just like Carol Johnson does, right?
Absolutely. From day one.
Mm-hmm.
It's just a mess. It's just a mess that, the remdesivir has been shown early on in a lot of the trials as being one of the most effective treatments for COVID, and yet money was not pumped into it so that it could continue the trials and, continue to see how effective it was. But yet it's available for this guy.
Now the other thing is that there's some people who say you can't believe a word he says. How do we know he's not faking it? He went in on Friday, came out on Monday. This sounds like it was staged, and no one can be 100% certain that's not true with this president. However, personally, and this is just my own opinion, it was a real situation. There are a couple of things that lead me to believe this. Number one, the fact is that we know that there is a raging pandemic that's going on in the White House. And so many people who were at that Rose Garden ceremony also tested positive. So if they were faking the president, would they be faking all those people as well? I don't think so, because we're talking about Kellyanne Conway, Kayleigh, the press secretary. We're talking about president's valet, Stephen Miller, Chris Christie. It's like a cast of thousands who have gotten it, and they all got it recently, and they all were exposed to the president or around the same people. Hope Hicks, I forgot her name. Can't even remember them all. The other thing that points to why this was a real infection is that the reports came out that, first of all, when he tested positive, they would say, "Oh, he only has mild symptoms." And as soon as I heard that, I was like, "Okay, it's worse than we think." The next thing that came out was that he was rushed to Walter Reed. And what came out later on is that the reason they rushed him to Walter Reed was because he had low blood oxygen level readings. And this is what I wanted to talk about. Again, this broadcast is not here to rehash what everybody else is doing on CNN, blah, blah, blah. This broadcast is to help keep us safe in COVID. So I want to talk about blood oxygen levels because it's a really important indicator when the COVID situation is getting worse and requiring hospitalization. And so they found that when it gets to that stage, there can be a remarkable drop in your oxygen levels, and often that's not indicated by any other symptoms, but when you see that drop in the oxygen levels, it's a trigger that you need to call 911 and get to the hospital. Why is this important to us? The reason why this is important to us is because, unlike experimental drugs, these are things that we can get. So here's a picture of an oximeter. It's a simple device. You put it on your finger, and it gives you a big readout of what your blood oxygen levels are. Now, is this a device that costs hundreds or thousands of dollars? No, it's a device you can buy in maybe CVS or Dwayne Reed, might cost $20. And so the reason why we're spreading this information, because no one is telling you these things. So we're saying right here today, if you haven't heard this, let's say you have either tested positive for COVID or you're showing COVID symptoms and you're quarantining at home. It's probably a good idea for you or a family member to get one of these oximeters and test yourself regularly, so that if you find a drop in your blood oxygen level, from yourself. You don't have to ask anyone else. Pick up the phone and call 911 and get the help you need. So this is information nobody else has been talking about, and we wanted to bring that to you, and again, use these situations to help give you information that you need.
Something
And that's
like
where
this.
we get. Sorry, Wally.
Go ahead.
Go ahead,
Something
Wally.
like this. Something like this. A person, even if they don't have COVID, should get it, so that way they can take it when they're well, and then they can have a standard or a reference as to if they do get sick. So if you know what it is when you're well, then you know where you're going. You have a reference.
Absolutely. So the other thing I want to tell you about it, just so if you got one of these things, what are you looking for, and what they're more or less saying as a rule of thumb. And again, we emphasize we're not doctors. We're just trying to get the information from other reliable sources. So as a good rule of thumb, a person with COVID-19 monitoring their status at home will want to see that their levels stay consistently at or above 90 to 92%. If it drops below this threshold, call 911. So we want to make it as simple as possible and give you a benchmark for you to work with. And these were the questions that were asked of the president as well. So there is, I saw one article by a doctor who was breaking down the response to the president, and he said this is exactly what doctors would ask. The first thing they would do is check those blood oxygen levels. And they also recommended, they talked about the issue, now this is going back into more of the politics of it. But one of the things about this crisis is that they avoided transferring power over to Vice President Pence, even though this is a situation where most of the time a reasonable president would do it as a precaution, because once you're losing blood oxygen levels in your system, you're at a point where you're not necessarily able to make rational decisions. And as president of the United States, that's actually what you're supposed to do. And so this doctor actually recommended that blood oxygen levels be used as a litmus test for whether power should be transferred, that if it reached a certain level, they would automatically say, okay, if it hits this level, then we need to invoke the section of that particular section of the Constitution, that because there's actually a section that allows for the transfer of power without the president's permission. But it requires everybody to do certain things, and no one in this government seems to have any backbone to stand up to this president. So those are just some interesting dynamics of it. But the most important thing for us to remember for ourselves is that you can go to the store and you can spend, maybe 20, 25 bucks, maybe less, on this device, and you can take it home. And as you can see on this device, you can see the number on there is 94%. So that's within that range that we talked about. So just another piece of information from us to help keep you safe.
And you know what the saddest part is that so many doctors at Walter Reed that was not part of his circus,
Mm-hmm.
who were actually being honest. And you're
Mm-hmm.
dealing with someone who has a questionable mental state as it is.
Mm-hmm.
And then to add the COVID in, which is that oftentimes, in particular, older people will have uh, forms of confusion, lethargic, being lethargic, not being able to make rash decisions. And that's one of the things that, other people, family members had noticed. People were bright, they were on point, and their mental state began to change. But then on top of that, this drug, the this drug, I'm gonna get the exact name for it, but it also causes a warped mental state. And so yesterday we saw the president is always, tweeting craziness, but his decision making was so up and down that from so many different stages, people were becoming more and more concerned about him, because this drug, they said, clearly causes confusion, irrationality. And so, at some point, the House Speaker needs to step up. They need to really question this as to whether he is still in position to be in that position.
I think I heard that, you know, I'm not absolutely sure of this, but I think I heard from the news that the vice president it has to be the vice president and the cabinet and the Speaker of the House to make this decision. But at the time when the vice president is, you know, part of the voting, the campaign for Trump, that would play a real uh, bad situation for the campaign. And so, even though it would be good for the country, and it, you know, and it probably even would be good for Trump. Um, this is a situation where the personal interests are taking priority over the country's interest.
Hmm.
You bring up a very good point because we are like a few weeks out from an election. If this had happened, you know, uh, 2 years ago, even when we weren't in an election season, it would be a completely different thing. But with all of the collusion and um, the stripping of rights and shutting down voting sites and uh, tampering with people's ability to vote, this is a very crucial time. And it gets scarier and scarier as the days grow long because we already had someone that we knew clearly was mentally unstable before any of this started. And now where we are, even like with the stimulus checks, you're not gonna sign them until after you win. Then I'm gonna sign it, but it's gonna be a limited bill. I mean, and these things were like within minutes of each other, these decisions. So it's a very frightening place to be, and this is why people really need to get out and look at this entire situation, how it was handled, how it continues to be handled, how these people are walking around, the president of the greatest land, in the greatest country supposedly in the world, is in this situation. He's almost like got his own personal spread. I mean, this thing is just moving around so rapidly. And when Bob spoke about all the different people that's been around him, let's not forget those people who were still part of the White House staff who was getting infected. Those people weren't riding in cars with him.
Hmm.
These were the cooks, the housekeeping staffs. Is these people now have it. So it's almost like he's got his own COVID cluster. And this is the time where these people that, for some reason, these states just seem to keep voting in. You need to take a good look at this now. And when this is over, midterm elections, look at all these people who are backing up the nonsense, the foolishness, the dangerous activity that's happening in our country, and get them out of those offices.
There's this term gaslighting, which is basically meaning that somebody who tries to tell you when the truth is staring in front of your face, they tell you it's not and try to tell you you're crazy. And the term actually comes from a movie back in the 30s or 40s called Gaslight, which some husband basically tried to convince his wife that he was crazy. And so the term caught on in psychological and medical circles. And that's what's going on at a very, very high level here. When you still see Republicans coming out and saying that there's hysteria around COVID-19 when 200,000 plus people are dead and the numbers are rising and we still haven't contained it, and there's outbreaks everywhere, and it's a global pandemic. So it's not like, Democrats made up a hoax and made it happen around the whole world. They don't have that much power. They really don't. So we have to just be mindful of the fact that this is going on. And it's not just in COVID-19. It's the same gaslighting that's going on around the voting process, because literally you're seeing these situations down south where you have one ballot location for 4.7 million people in Houston. One location, really? So, when we see voter nullification, when we see systemic racism that's literally being pushed in front of our face, when you're seeing lack of attention to basic medical protocols, and then people are telling us that nothing is wrong, we have to understand that we're in a very, very unique situation, and the things that we have been talking about at Harlem Emergency Network about protecting yourself, your family, and your community, they're more important than ever. The things that we've been saying, we're saying them louder now. We're hoping that you take this information and share it with people because you have to now take take stock of what's going on and protect your family. The truth is, we still don't know what's going to happen on November 3rd. And even with the polls saying that that Joe Biden is comfortably ahead, Hillary Clinton was comfortably ahead 4 years ago, and we saw how that worked out. And now we're in a position where this government has solidified more power in the judicial branch, particularly the Supreme Court, and they're trying to push through another one. And then they have control of the Senate, and they have a significant minority in the House. So there is no functioning branch of our federal government right now. They're all tainted and toxic. So as we, as a people, as community, we need to start by securing our persons in the form of making sure that we are optimizing our own health. And that's not only taking the nutritions we talked about, it's also about getting the proper exercise and proper rest. You've got to do that right now. You've got to make sure that you've got supplies in your household. I saw one prepper video, and it's interesting, they may have different points of view politically, but everybody's seeing the same amount of risk. And this video is advising that people need to have enough supplies in their house to be able to go from November 3rd straight through the inauguration without having to leave if you have to. Because this is the time when we're going to have the most risk, because regardless of who wins or loses, there's a potential for violence, there's potential for unrest, there's potential for civil instability. We've got economic issues now. President Trump has said he's not going to approve any stimulus plan until after he's elected again. And so he's holding the stimulus money hostage, which means that this economy is not going to be recovering anytime soon. And so we have real issues. We've got food insecurity issues. We have issues of rents and evictions. There are a lot of major problems. And we're not saying this to tell you stuff you don't already know, but we're saying this to say you've got to protect yourself. I want to jump back for a second because we've had Lynn Miller, who's been watching on Facebook, and she had some information about the dexamethasone steroid that they've been giving to Trump, as well as the Regeneron monoclonal antibody cocktail. And so, and I bring this up just to say, all of a sudden now COVID's important enough that they have to rush every experimental drug that they can find, and now all of a sudden they're looking to unwind the vaccine restrictions and push something through. And Trump evidently wants a vaccine before the election so that he can prove that he's Superman or something like that. And I say all this to say we can't get involved in that. We have to take care of ourselves.
And vote.
And vote.
And vote. I mean, this guy's clearly, I mean, when you look at the situation, how it's already been proven that after quite a few of these people had already tested positive, they were still willing to go into large crowds, rallying, unmasked. When you see the actions of his camp, even at the last debate, where the protocol was set in place by the university, by the medical center, that they had to wear masks, and they wore them going in the door and then removed them.
Hmm.
You know, and it seems like there's no one that can put a stop to this guy. So Friday, the day before he goes in the hospital, he's at rally. He's at his golf club.
And he knew he was positive. Knew he was
We knew he was
positive then.
positive. He's
Matter of
making
fact,
a mockery of 200,000 plus people who died.
he probably knew he was positive at the debate because you notice that he came late and they didn't test him before the debate. That wasn't an accident. That wasn't an accident.
Exactly. So I mean, when you think about this, he is making a mockery of every death. The 7 point how many million people in America who are now suffering from COVID-19 or who have tested positive. He is making a total mockery of it all. He came out of the hospital, and that very same day, I believe it was within an hour and a half, he began to tout that he's going to create a button, which you can pre-order because they hadn't been created yet, a button that says, a coin that says, I beat COVID for $100 a pop.
What?
Yeah. I mean, this had to be, you just came out of hospital. You didn't look well. Immediately got to the White House. Immediately just took off the mask. And like I said, all the people that's been moving around with him is one thing. But the housekeeping staff, the janitorial staff, the cooks, all those people in the White House,
The Secret Service.
and some of them are affected. And they said there's more, but so far they've only mentioned 2, and that they were all instructed, do not talk about what's going on in here. So this man is literally putting everybody's lives in danger, and he doesn't care.
Mm-hmm.
And if that's not enough to make you change your mind if you were thinking about voting for him, especially if you knew somebody that had COVID, or if you had COVID, or you know somebody who died from COVID, this is your president taking this as a joke. And now he's going to hold that little stimulus money hostage. Don't be fooled. If you got the first check, good. Do not be fooled by that. Because at the rate he's going and the rate they're holding up testing and tracing, you may not even be around to be able to spend it if it ever comes out. We have to take this thing seriously, more seriously than we did before.
It looked like when he took off his mask, he actually had to hold himself throwing the mask down on the ground. It looked like he started to do that, and something told him, just put it and hold it in your hand. That's how he really feels about it. If you look at that picture, he kind of took it off, and you're wondering what's he gonna do with it. And he had to think about it himself, So that mockery thing you're talking about is real.
Yeah, somebody might have told him that might take it a little too far. Don't do that. But I mean, he doesn't care. That's the thought process.
He looked like that wasn't planned, and he did it on the spot, and he had to think about that himself.
Mm-hmm.
He had to think about that himself.
Yeah, that would have showed the imaginary S that he thinks is on his chest.
Yeah.
Yeah, that's a very interesting point that was just raised. 15,000 people died while he was in the hospital.
Mm-hmm.
Running around doing photo ops, infecting the people in the car with him. Hermetically sealed car.
Mm-hmm.
And military. We talk about the people in the military. Weren't they there at the Rose Garden? Bob?
Yeah. Well,
Yeah,
you seen that how many of the Pentagon leaders are now
yes,
infected, and so what you're talking about is a crisis on a national level where we have an epidemic going on in the leadership of the country that again was totally preventable. It really, of all the people in the country that should have followed COVID-19 protocols, the leaders should have, because now you have a whole lack of leadership. So now what happens? You have generals and top military officials who are now self quarantining. We have senators self quarantining. We have top White House staff self quarantining or quarantining or having ill effects. It's crazy. And at the same point in time, they're still going to look us in the face and tell us that there's not a problem, that the problem is solved. We're overreacting to it. Don't be afraid of coronavirus, is what he said the other day. No, be afraid of coronavirus. You don't have to tell us. We already know. But for the rest of the country, y'all better wake up.
yeah. Don't let it dominate your life. Was another statement that he used.
Well,
But if we are correct about the information we've been receiving all of this time, anyone who thought that they had anyone who thought they had come in contact with someone who had this virus should be quarantining for at
mhm,
least 2 weeks. Why are they still talking about debate? It's not 2 weeks since Trump has been in Pence's presence, but he's still talking about going to do a debate. You know,
crazy.
it's get out. These people are in a sunken place.
And believe it or not, masks are still optional in the White House.
Yes.
Is that crazy?
We're talking about one person who somewhere along the line plays into more than 40 people having this virus. And then others getting it. There's one of the senators whose family members is positive. Kellyanne Conway's daughter has it. So it's going to continue to move around. It's not just going to sit there because
Hmm.
they were around them and they went home.
Hmm.
And who knows who else. So it's a pure example of the mockery
Hmm.
of this deadly disease, because how many people were at those rallies? How many people were each one of those people that's infected now, that's part of his camp? How many people were they around?
Hmm.
Because they were having rallies. One of those
Well,
senators in Jersey was
how,
having a rally and
And
he
then,
tested positive.
how do they have the authority? I mean, that the contact tracing is a must. How do they have the authority to tell the CDC that they can't contact trace
Yes.
their
well,
this is
because the
this is crazy.
CDC reports to them. CDC reports to Health and Human Services. We've already seen that the Secretary of Health and Human Services is another idiot for Trump. The In Washington D.C., the local D.C. Health authorities were unable to do contact tracing because the White House wouldn't cooperate. And so we know that there's an epidemic, a pandemic going through the White House because every day they announce somebody else who has it. But amazingly enough, none of the rest of that staff is being protected by contact tracing. And so, this is a microcosm of the problem that we're having. The 200,000 people were not killed by COVID. COVID was the cause of death, but they were killed by stupidity. Really, past the first 25 or 30,000, the rest of this is all based on people not paying attention to what already happened. Because the rest of the 200,000 happened outside of New York after we came, and we got slammed in March and April. We lost, 20, 25,000 people in a matter of 6 to 8 weeks. and then we cut down our curve. So the rest of that 175,000 is the rest of the country, and they should have known. But they ignored what happened here and assumed that it would not come to their city and their town, and of course it did. And so these are preventable deaths.
Hey, listen, the guy says they absolutely refuse anything from the CDC, the medical professionals.
Mm-hmm.
The White House has totally refused. We're in a public health, a medical pandemic. And they absolutely refuse any input from the medical community, the epidemiologists, the people who study this, the people who do this. The same people that were called on when President Obama was in office. The same information that he left this president with. The same people that he fired immediately. The same information that President Obama said, we are going to come in, we're going to see it. When we see something come at us, we're going to see it. We're going to jump on it. We're going to eradicate it. And he said, not just here, but we have to think about a pandemic.
Mm-hmm.
We have to take care of other countries as well. And this is the same man that immediately, upon coming into the White House, dismantled all of that. Now we've got over 200,000 people dead. And right now you are still saying you will not accept any help from the people who do this. No help. We don't want your input.
So, to sum this up, to quote our brother Barry Crumley, yo, you're on your own. We can't emphasize this enough. This is a time you need to take stock. This is the fall, not to quote Game of Thrones, but winter is coming. And we don't know what this winter is going to look like, but we suggest you get prepared now. And obviously, as we said, everybody needs to go out and vote, but you need to be prepared regardless what happens. Whatever the vote goes, one way or the other, you still need to be prepared for situations. You need to be prepared for your health. You need to start to be preparing for civil unrest. It's just that time. And again, we're not here to scare you, but if you're not paying attention to the signs that are going on, you're even at more risk. So.
And we just got this just in. Joe Biden told them, I'm not debating Trump as long as he still has COVID, so they can kill all of that stuff.
Yeah, and that makes sense because
it makes absolute sense.
There's no upside to another debate. Most people said that after the last debate. It's just an opportunity for him to act the fool on stage. And if you're not going to have a real conversation about policy so voters can make an informed decision, it's just going to be a lot of histrionics, then it doesn't make sense. And it's the perfect opportunity to not do that, because why should Joe Biden, who is also in his 70s, why should he expose himself in a situation where people who are known to have COVID are going to come in, people who basically exposed him the last time because he came in and didn't test beforehand, which it probably would have revealed what was going on. So that's a smart move for him. So we want to recap a couple of things just that we talked about in this particular live cast. We started out by mentioning the fact that New York City is in a state of a partial shutdown of hotspots in Brooklyn and Queens, centered around some of the Orthodox Jewish areas that have been flaunting the COVID restrictions. And as a result, it's the numbers. The numbers don't lie. So, it's not, there's no one is targeting those areas. Those areas are targeting us by not paying attention to conventions. And I also want to say this, one of the things about Harlem Emergency Network is that we support people of all religious faiths. We don't believe in any religious persecution. We believe people should worship as they want to and need to. However, let's draw a distinction between religious conventions and social conventions that are part of particular religious practices. So, for example, if a Baptist church were to say, hey, these COVID restrictions are preventing us from having the men's breakfast or the women's retreat, we'd have to say, wait a minute, that's not actually a part of your religion. That's a social convention that happens around your religious body. It has nothing to do with your religion. These guys dancing out in the streets in Brooklyn and at nighttime, that's not in the Torah anywhere. So we need to squash that nonsense and just say, even if you are a house of worship, you've got to follow protocols that protect not only you and your worshipers, but also the community. New York is a dense community of diverse people. And while we respect everybody's right to live and participate the way they do it, it's not acceptable when your right to live and participate in your way of life puts my rights and my life at risk. And so I believe that Governor Cuomo in this situation did the right thing in identifying particularly what the problem was and not stepping around it or trying to, Carol and I had this discussion 2 weeks ago, how Mayor de Blasio was reluctant to say that it was a cluster of places. He was reluctant to use certain language and reluctant to put the finger on where the problem is. And the thing is right now is that when we have problems, we need to look them squarely in the eye. So the first and foremost problem we have right now is that we're seeing an increase in COVID infections here in New York City. We need to protect ourselves, shut it down, and every one of us need to pay attention to what's going on. The second thing we talked about the president's infection and what we can learn from it. And what we learned from it is, number one, that the president is still taking vitamin D and zinc, just like we've been talking about. And no matter how good these so-called super drugs from the pharmaceuticals are, they're not so good that they're not taking a chance to not use the same things that we're doing. And the other important thing we talked about was understanding how to monitor your blood oxygen level. Get a $20 device that can help save your life. If that number goes below a certain amount, you could call 911, and you might not have a symptom that tells you otherwise until it's too late. And the third thing was get out and vote. And there's one more thing we didn't talk about, which is we wanted to bring up the fact that we're not going to belabor the issue on the mess that happened in terms of reopening the schools, but we did want to say that we saw some information that the Department of Ed is giving out 100,000 more new iPads for students. We know that students in our areas have been underrepresented in terms of getting those devices, so we wanted to make that information available. And I think, let me see if I can get the actual address that people can go to to do that. And I want to put that on screen. Okay, it's schools.nyc.gov/devices. All right, so if you are a parent or you know of a family that have not gotten their school devices, go to this website, make sure you sign up. We're probably going to have Clayton Banks from Silicon Harlem back on our broadcast to talk a little bit more about this. We talked about it midsummer. It's still an issue and a problem. But we have to use our resources to help everybody out. Anything I missed, Wally and Carol?
No, I think we've pretty much covered everything.
Mm-hmm.
Tune that immune.
There are other things going on. There are other things going on in the news, but we don't get a chance to even see it. You know, they've blotted out the world news
Mm-hmm.
as far as this situation in the country.
Right. Well, we can get into that, but we'd be here another 3 hours catching up. But
another 3 days.
Another 3 days.
Right.
So I want to remind you, if this information was valuable, please share this on your timelines, whether you're on Facebook or whether you're on YouTube. Share this information, send it out to people. Like us on Facebook because it helps us. Subscribe to us if you're on YouTube. That helps us out as well. And just get the information out to your neighbors. We have to look out for each other. And if we operate together as a community, we can get through anything, no matter how challenging it is. Thank you, Lynn Miller.
I want to give a shout out to Miss Miller. Oh, see, she came in. Like minds think alike.
Right.
I want to give a shout out to Miss Lynn Miller for joining us this morning and for her valuable information.
Yeah.
And so that's the message I sent to her. Thank you.
Right. And also shout out to our brother, Mark McPhee, who's always here with us and who always does a great job of sharing our information. One of our great community warriors. And, there are a lot of people in our community we have who are really doing great jobs in getting information out and really committing to us. I'm gonna take this opportunity just to shout out Carol Johnson, who's on our broadcast right now, who is responsible for over 10,000 masks being distributed during this pandemic. We have people who are working hard to get you the information, and they should not be ignored. We should be listened to, and share this information. It might save a life. We will be back next Wednesday, same time, 9:30. Meanwhile, all of our broadcasts are archived on Facebook and on YouTube. So please go back and listen to some of the others if you haven't heard of them. Tune your immune system and come back next week. We'll be here.
Yes, indeed. Have a great, safe week.